Autism results in communication difficulties, unusual ways of relating to people, and odd or repetitive behaviors. Police are sometimes called when such actions are misinterpreted. Emergency response professionals may have trouble communicating with or assisting persons with autism in an accident, fire, or other crisis.
Bakari is 25 years old. He's very mild-mannered. He's very tall. He's happy. He smiles all the time. He loves people. Bakari works at the Richland County Library. He's been working there since 1995. He is a shelver. He loves the environment, and the people seem to enjoy having him there, and he seems to sense that they want him there and they enjoy having him there and talking with him.
Bakari sometimes has trouble answering questions. Listen to how questions may need to be rephrased and how it takes time for him to answer.
How long have you worked at the library?
I work there every month.
You work here every month?
Yes.
Well, when did you start working here? When did you start?
In 1995.
What do you do here at the Richland County Library?
I shelf books a lot.
You shelf books a lot?
Yes.
What kind of books do you shelf?
I shelf biographies, mysteries, and science fiction.
Bakari has a problem with trying to cross streets. He gets very frightened when automobiles are heading towards him, whether they're actually coming to hit him or not, but he gets very, uncomfortable with that. So we chose to allow him to ride the DART transportation to get him to work and to bring him home. My fear would be that he might become confused, and in trying to ask for help, because he will try to get help from people, that because of the way he speaks, no one will understand what he's trying to say.
Jack is very talkative, but often has problems getting his facts straight. This is one reason he carries an ID card.
How old are you?
30, how old am I? 33 or 2, I think. 24. My birthday's December the 8th, 1993.
You were born in 1993?
Yeah, 1993.
Are you sure?
1993, I think it was. I think it was 1993. 1973.
Jack's a neat kid. He's got a lot of interest. He enjoys people. He enjoys his job. He lives independently, which I think is great.
His mother worries that his actions might be misinterpreted by strangers, or worse, that he could become a victim himself.
Jack will go up to people that he doesn't know and try to start a conversation. Doesn't pick up on innuendos like, I don't want to talk to you. Everybody's his friend. When he's talking to a person, a lot of times he doesn't understand the conventions of space, and he will get in too close to a person in a conversation. Makes people uncomfortable, but he doesn't realize it. And he was misunderstood for somebody on drugs or substance abuse.
Jack had a frightening encounter with the police when he wandered out of his family's apartment at the beach. It was 2 a.m. He became disoriented and walked inside a hotel.
And they asked Jack if he had taken any drugs, and he said yes, because he's on medication. So immediately the police were called. And when Jack saw the police pulling up with the blue lights on, it frightened him, and he started to run. I think he was going to run back to where we were. They said he was running right out toward a major highway, and they could tell he had no sense of direction, no fear of traffic. So they tried to jump Jack and put him to the ground, and when they did, he put up a great deal of resistance, and in the scuffle, he threw his head back and butted a policeman's nose. I think he broke the man's nose, and the other officer, somewhere in the middle of it, one of the officers picked up that something was not as it should be and started trying to talk to Jack, and as he talked to him, he realized that you know, this is not an ordinary situation. Even though they did hold him in a cell, he made every effort to find his family and ask Jack a lot of questions.
Bakari and Jack can communicate with speech. Brenda cannot. She, too, wandered away once despite the many measures her family takes to keep doors and gates locked. Her father quickly found her a few blocks away, but not before police and child welfare professionals had been called. After talking with Brenda's family, neither agency pursued the matter further. Her parents explain how Brenda might act in a crisis.
She would not want you to be touching her. She would not want you to do anything to her. If she wants something done with you, if there's interaction between you, she has to initiate it. And so for a caregiver, it's going to be very difficult to do anything for her.
And the fact that she doesn't have any language, she would not respond appropriately to, you know, are you hurt, or can I help you, or where do you live, what's your name? She wouldn't help with any of that. And I would imagine she would probably just throw herself on the ground and try to run away. I would say lessen the noise if possible, or have one person talk firmly and slowly and, you know, use a firm grip.
Bakari's mother describes how he might appear while trying to cross a busy street.
He would be repeating something over and over again. He would be probably moving from foot to foot, arms up, because he's trying to figure out how to get across the street. To approach him with a soft tone of voice, calming tone of voice, slow talking would calm him down, and you would be able to approach him, to touch him, to help him. When someone is approaching an individual like that, you approach them very slowly, and you try to say to them to calm down. I want to help you. Can I help you with what you're trying to do?
Try to be patient and calm when assisting a person with autism. Avoid touching if you can. Keep your questions simple. Pause and repeat them if you need to. Try rephrasing. Try to find someone who knows him or her. An emergency can be especially frightening for a child or an adult with autism. Special care and assistance will be required.